The government of British Columbia, Canada has finally been caught for intentionally creating a drug culture and pandemic with the intent to profit, as the BC government partnered with one of the largest pharmaceutical companies and distributors in the world, a company called Purdue Pharma L.P., formerly the Purdue Frederick Company, is an American privately held pharmaceutical company founded by John Purdue Gray. It was owned principally by members of the Sackler family as descendants of Mortimer and Raymond Sackler. Wikipedia. CEO, Craig Landau, the 22nd of June, 2017. Headquarters, Stamford, CT. Number of employees, 5,000. Worldwide. Founded, 1,892. Founders, John Purdue Gray, George Frederick Bingham. Fate, liquidation due to Chapter 11 bankruptcy and legal issues. Purdue Pharma has a Canadian branch based out of Toronto and has had many lawsuits, including one by the British Columbia government. But here's where things get interesting. It turns out after the BC government sued Purdue Pharma, they ended up doing the exact same thing as Purdue Pharma but with fentanyl and Dilaudid, another one of the most powerful and addictive drugs known to humanity besides OxyContin, which was the original drug they created which started the opioid crisis. And it turns out the BC government is selling and distributing Dilaudid, and guess who the manufacturing company is? Purdue Pharma, the same company the BC government sued for the opioid crisis in BC.
How did this happen? How did we find ourselves in this dystopian reality? Well, according to Marshall Smith, this all began with another medically prescribed opioid, OxyContin.
So this really started with a company called Purdue Pharmaceuticals. They are widely credited for these actions. They doctored the research that went into the safety and effectiveness of their product. They infiltrated the medical regulators. They did everything that they could to get their product, into the hands of patients. And of course, because there was so much of it, going out onto the street, dealers would get it and remarket it, which is often what's happening with these safe supply drugs now.
After decades of devastation, the BC government launched a class action lawsuit against Purdue Pharma for their role in fueling the BC addictions crisis. But ask yourself, how is government-funded safe supply any different than Purdue selling of OxyContin? Especially when you consider that Dilaudid, the brand name for the hydromorphone currently being distributed by the government, is manufactured by the exact same company.
You saw all of the damage that was created by OxyContin in the community. Hydromorph is 2 to 3 times stronger than OxyContin. Stronger than OxyContin, for sure. So this is a way bigger, issue.
But OxyContin caused the problem in the first place.
Yes.
So the government went after Purdue,
yes,
kind of took their pill bottles off the street,
yes,
and then are supplying a drug that is basically the same except even more powerful.
Yes. So they're doing the same thing today that they are currently suing these companies for doing 10 years ago.
Except the drug's more powerful.
The drug is more powerful, yeah.
The BC government has intentionally created a drug pandemic to profit directly from the drug trade as they now legalize it, and push this false harm reduction agenda to normalize it and brainwash the public into thinking this is the right thing to do based off their falsely generated data. But what it's done is create more drug users and keep them alive longer, so the BC government can increase their profit as they are the main supplier. The government has taken over and bought out the prior main supplier, Purdue Pharma. Now they are partners. The public lawsuit from the BC government was to make it appear as if the BC government is the good guy, and Purdue Pharma is the bad guy, all to then just buy out the company or partner with them to profit from the drug trade, and transition into the BC government now being the main supplier of the drug trade. This ties directly into the homelessness pandemic and the mental health crisis, which puts pressure on the medical system, hence why the healthcare system is so broken and falling apart in BC. The government is intentionally creating homelessness and mental health distress on the homeless by design, which leads to trauma, and then they prescribe you drugs to help with that trauma, and offer you pain pills like Dilaudid, too. intentionally get you addicted and dependent on the BC government and pharmaceutical industry it now controls. If you were a drug dealer, would you want your customers to die? No, you would give them Narcan and keep them alive longer, so that they could buy more drugs from you. If you were a drug dealer, would you want your customer in jail? No, because then he's no longer buying your product. What you think of a drug dealer is actually the government. Non-profits and charities like Our Place Society and Victoria BC, along with Kool-Aid Society, the Coalition or Alliance to End Homelessness, Victoria ARC, the Salvation Army and BC Housing are all involved in this scandal on a lower level, to also create a system that feeds into the one that the BC government created. So, non-profits, charities and organizations related to homelessness, mental health and addiction actually are positioned and designed by the infrastructure and foundation up to contribute to this machine by creating systems that contribute to addiction, mental health and homelessness, so that they can keep getting paid, because if there are no homeless or no drug addicts, there is no money, no jobs, no 200k per year salary, no more reason to be raising millions in funds towards homelessness, even though a small fraction actually goes to the cause, all by design systematically. Yes. A real-life nightmare, a multi-layered sophisticated organized pyramid scheme and a mass genocide plot initiated by the BC government. Justin Trudeau is directly involved. A documentary called Vancouver is Dying, recently released with over 1 million views in a week, reveals how Justin Trudeau is also funding this campaign and profiting from it. It's becoming an international business model for Canada now, targeting those in poverty, those who struggle with mental health and addiction, to only capitalize from the suffering of these people for the development of wealth for the wealthy, government, the elite, Freemason, Illuminati royal family, satanic cult, pedophile demons, who run this world and its currency. Everything is connected and it's more visible and easy to follow than ever. They don't care if we know anymore. It's wide open. Too late to stop it, but we warned you. Go to victoriabcprofits.ca to see how the BC government is also systematically creating homelessness in BC's capital, Victoria, BC, to then create more addiction and mental health issues to force people to be more dependent on the government and pharmaceutical industry, which the BC government owns and controls, all for profit, trillions and trillions of dollars, increasing their revenue yearly off the drug trade, which has overloaded the medical system, which has also been infiltrated by evil and sick people. BC is by far the most corrupt province in Canada. There is little to no medical care in BC. All the medical entities such as Island Health are corrupt and also operating for profit maliciously. I've never witnessed such evil and corruption, especially when it comes to the medical system in BC. Let's actually do some recognizance and OSINT. Let's investigate Purdue Pharma. We scanned Purdue Pharma's website to enumerate any usernames to identify anyone behind this company or who controls the website, along with the website's internal information. WP Scan is a tool used in Kali Linux used to scan websites for vulnerabilities and exploits in order to see if that website has any vulnerabilities or weaknesses. It can be used to brute force or break into a WordPress website, which we do not endorse, as this would be illegal and unethical, but scanning and enumeration can be done in legal boundaries. This was the information we got back. Purdue Pharma, www.purduepharma.com. User S identified plus Ahmed Ejaz plus Purdue. So we found one name, Ahmed Ejaz. You won't find much information about this person anywhere on the internet, but one thing we did find was this admin also operates another website which sells, manufactures and distributes children's laxatives, gummies and other medicines or drugs for children. This is pretty evil shit on a mass scale. I wonder what the biggest drug dealer pharmaceutical company is putting in kids' gummy laxatives and other medicines for kids. Targeting children now, getting them hooked to drugs inside their other child products. Most likely, the website is avreohealth.com. When we scanned this site and found the admin was Ahmed Ejaz, and was a parent company or founded by Purdue Pharma, but it had to do with children medicines. The URL we found with the information of the kids' gummies and laxatives was avreohealth.com, author Ahmed Ejaz Pharma.com, which we took a screenshot of, and good thing we did. Have a look. The very next day we went back to that page from the same URL we saved, and we saw this, page not found. Good thing we already took a screenshot of it prior, and you can see the URL is the same. Put video or screenshot of kids gummies page them page not found. Now we see how deep this goes. Creating early generations of drug users by targeting kids and using the harm reduction enabling system to normalize it, keep people addicted, sick and homeless, and extend their lifespan to maximize and increase their profits and revenue as they're profiting from the drug trade, working alongside organized gangs like the Hells Angels, accepting bribes and collecting a percentage of the drug trade from the bikers, through the RCMP up to government officials, all in synchronized order with their entire drug pyramid scheme and scandal. This is no longer a conspiracy but known documented fact, and factions of the BC government and entities run by the BC government have been already caught for fraud, including the non-profits organizations and charities in Victoria, BC. BC Housing was just on the news again, as they won't disclose their salary and have hidden and won't produce certain financial documents and statements to prove they haven't been committing fraud, and they are currently in lawsuits and under investigation, but it's just a part of the game. The government will just infiltrate further and move new corrupt positioned people into CEO positions of these organizations like a game of chess. It's all a part of the scandal. Visit www.victoriabcprofits. All the shelter staff and management that deal with the homeless are intentionally abusive to the homeless, contributing to mental health crisis, and they have created a system to profit from it, generating over $500 million per year in Victoria, BC alone, and the Salvation Army charging the homeless $600 per month to live in a dorm with 30 other men, in children's bunk beds, getting eaten alive by bedbugs. 147 beds, over $88,000 per month being generated by the Victoria ARC or Salvation Army, but inside are inhumane conditions, food gets you sick, jail showers, and stacked like cattle for profit. Now you understand why there is a Pandora Strip. And the East Hastings Strip. This is why. This is why BC is the worst province for drug use. They created this drug culture on purpose. And all the organizations, non-profits and charities claiming to assist with poverty relief are doing the exact opposite, on purpose, to create more homeless, to increase the demand so they can request more funding to pocket for themselves, create jobs for themselves, pay themselves $200K per year salaries, and do nothing. Getting paid more than a doctor. It's mass genocide. We are anonymous. We are legion. We do not forgive. We do not forget. Expect us.